Hey guys, it's Kristen. Welcome back to my channel. If you're new here, I am a new grad physical therapist. I just graduated this past May with my doctorate in physical therapy from Mercer University in Atlanta, Georgia, and I recently started my job in July, so it's been a few months now as a physical therapist. I work in outpatient orthopedics as well as pelvic health, and in just 2 weeks here, not even, more like 1 week. Next Monday, today is a Saturday, so not this Monday, but the following Monday, I start my new grad residency program, which is in women's and pelvic health. And I am absolutely so excited to start vlogging again and taking you guys along throughout that journey, because if you have been subscribed to my channel, you know that I vlogged my entire DPT journey from literally orientation through graduation day. So I'm really excited to take you guys on this next chapter of like my new grad residency life. I am really sorry I haven't been uploading very consistently these past couple of months. It has been really hard because honestly I've just been working from, like I said, July till now, October, and since my residency hasn't started yet, every week really is the same, so it really is hard for me to vlog. So I'm sorry, but I am going to start vlogging more regularly again now that my residency is starting up. Today I just wanted to kind of catch you guys up on everything that's going on in my life, so I figured what better way than to do a question and answer video. So I compiled a list of good questions on my phone here, and we will get into it without further ado. Okay, so the first question is just, how are you doing? And I think this is really sweet that you guys care like how I'm doing, you know? But I will say, I've talked about this in some of my vlogs, it was a pretty rough transition initially, going from being a student in clinicals to being all on my own as a physical therapist, but I definitely am finally at the point where I am settled in, a lot more confident and a lot less anxious just day to day. Obviously I still do have those bad tough days, those days where you have really tough evals and you have no idea what the heck is going on, but for every bad day, a good day kind of makes up for it, and just seeing your patients progress and get better and have decreased pain for the first time in sometimes years if it's a chronic condition or something is really rewarding. So overall I love my job and I am really happy with my decision to enter the field of PT. The next question is one that I have been getting for so long in tons of comments and DMs, and that is, how much do new grad physical therapists make? And I thought about making an entire video just on this topic, but I feel like it would be so short because obviously there's only so much that you can talk about. And I will say I don't feel comfortable sharing like my exact salary because I don't want to get in trouble or anything. I'll say from what I know from like my salary and talking to my other friends that are new grads, at least in Pennsylvania where I'm living, and Georgia where I went to school, so I can't speak for any other states, but from what I've heard, sort of typical starting salary for like outpatient clinics is like, I'll say around 70 to 80K, and I know that can vary a lot, like I said, depending on like specialties that you're working in. If you're working in home health, I know that they make a little bit more. If you're working at private practice or hospital system, you might make a little bit more, but I would say 70 to 80K is kind of a typical starting salary, and it is important to note that that is before taxes, so you need to take out about 20% or so to factor in taxes. And I am really happy that I get to share this information with you guys, because if you just Google average salary of a physical therapist, I'm going to do that right now to share with you guys, because it is not reflective of like what new grads make. This Google search says the average physical therapist salary in Pennsylvania is $98,000, and that is from salary.com. So obviously that's not very reflective of what new grads make. That's like a seasoned clinician that's been working for years and years and years. So I don't want you guys to think like you're going to go through all this 7 years of schooling and be in a lot of debt and then be making right off the bat 98K, because that's honestly not realistic, and I would expect to make about 70 or 80K starting out. How much does your residency program cost? So my residency actually doesn't cost anything. You really need to do your research when it comes to residency programs if you're interested in them, because they're all super different, and some of them will require you to pay tuition, some do not. Some will take a salary cut, kind of in place of you paying tuition. So really do your research, but mine personally, I get full salary and then I don't pay anything. Second year PT student tips. Honestly, just soak it all in, try to absorb as much as you can in class and ask all of the questions. Don't be afraid to ask questions because this is the last time you're going to be in the didactic setting before going out for your clinical year. So just try to soak it all in and don't be afraid to sort of step out of your comfort zone a little bit and maybe like go to office hours or approach an upperclassman for help with any skills you might be struggling with, because this is really your last time to sort of grow in that way. How are your clinical experiences in various different settings? So my program at Mercer, we did 3 12-week rotations in our last year, and I did do like dedicated videos after my first one, which was outpatient orthopedics, and my second one, which was in acute care. So you can check those out for like full-on sort of experience videos. But my first clinical, I absolutely loved. It was in my hometown in Pennsylvania. 12 weeks in an outpatient orthopedic clinic that only had about 4 other therapists, and they all were sort of within 3 to 5 years of graduating, and they were all girls. So the environment of the clinic was just like so fun and so social, and I absolutely loved it. I actually was super close to working at that clinic if I hadn't done this residency program that I'm doing. I still keep in touch with all those therapists, and I absolutely love them. They're some of my closest friends now. But I really liked my outpatient ortho rotation. I feel really lucky because I know a lot of people, when they are in outpatient settings, they're kind of at one of those like PT mill sort of chain clinics, and they're just kind of seen as free labor rather than you're there to learn, which I think is absolutely horrible and so sad. And if you are in clinical like that, I feel for you so hard, because that's not what clinical is about. You should leave there a better clinician and knowing so much more than when you started, and that is the experience that I personally had. So I'm so thankful for that rotation, because even now as a new grad therapist, like I find myself every single day, every single patient case, like referencing back to that clinical and kind of pulling my knowledge from there, even more so than my didactic knowledge. So I'm just really thankful for that good experience that I had. And it did make me like outpatient ortho so much more, because I wasn't quite sure if that's sort of where I saw myself. I always knew I wanted to do public health, but I didn't know about the ortho portion. So that really kind of inspired me to go that direction. My second one was in acute care, and I was really nervous because I never saw myself working in acute care, and I don't do the best with like needles, blood, sort of gross things, and that's what initially drew me to PT in the first place versus like nursing, PA, pre-med sort of stuff. So I was so nervous, but I had the most fun. I was at a smaller hospital in Georgia, and we weren't just on like one floor of the hospital. I know a lot of people that have acute care rotations will just be in like the ICU, the med-surg floor, they'll be in a certain unit. We were everywhere. So I was in the ED, the ICU step-down unit, the NICU, the COVID floors. I saw everything under the sun. There was never a dull moment, and I had 4 10-hour shifts, which was absolutely so nice. So I really liked that rotation, and honestly I liked acute care a lot more than I thought I would as well. And then my final rotation right before I graduated was 12 weeks in pelvic floor PT, and that is actually with the same company that my residency program and my current job is with, and also had a great experience there. Really grew my comfort with pelvic floor and doing initial evals in that setting. I did take my Herman and Wallace course prior to that rotation to prepare, and I think it prepared me super well. So overall, I feel really lucky to have had like the best 3 clinical experiences and the best clinical instructors ever. If any of y'all are watching this, I love you and I miss you all. But yeah, those are my experiences. What are your work essentials? So I definitely would say having a good water bottle. So I have this water bottle that's pretty big, and it has the times of day on it, and it's from the brand Venture Pal. If you guys are interested, I'll have it linked down below. But basically it's like 9 to 1 o'clock, and then you should finish it by 1, refill it, and then 1 to 7. So that really kind of keeps me on track with my hydration, because before I had that water bottle, I would find myself like not drinking all day and then feeling so sick. So definitely having a good water bottle, and also protein bars. We only have 30 minutes for lunch, so a lot of times I'm like trying to document and I don't have time to like heat up something in the microwave or like take spoonfuls of things. So I absolutely have been loving these protein bars. They're from First Form. I've been talking about them in my vlogs, you guys, but they literally taste like candy. This one is chocolate peanut butter pretzel. They also have a cookie dough one that's so good. They have a pumpkin spice one, which is like white chocolate and so good. 20 grams of protein, really awesome. A great snack too if you have like a patient cancel and you just want a quick little bite to eat. So good water bottle, protein bars, and also ibuprofen, because you never know when you're gonna have like a headache or an ache or a pain. So that's something really good to just have in your bag. Would you ever consider doing home health? I would say maybe. I know some pelvic health therapists do home visits with the mom so they don't have to leave their baby, sort of thing, and I could definitely see myself doing that in the future. If you guys don't know, it's my dream to open my own practice, and I definitely would want to have a storefront clinic location, but potentially offering home visits would be really cool too. Did you take the jurisprudence law exam before or after the NPTE? So I had to apply for licenses in 3 states. I applied for Delaware because that allowed me to take my NPTE before I graduated, because Pennsylvania does not allow that, so I couldn't have sat for that in the April test date, and I graduated in May. So I took it in Delaware. They don't require a jurisprudence exam, so I just did the license. Then I transferred it to Pennsylvania, which doesn't have a jurisprudence exam. And then I also needed to get my New Jersey license for my residency, because I might be working in New Jersey for a little bit. And that one I did need to take the jurisprudence exam, but that was after the NPTE, because at that point it was like months after I had started working. So I would say check with your state when kind of is the best time to take that. Any anatomy tips? Oh my gosh, this really takes me back, because it has been like a good 3 years since I had to take gross anatomy in physical therapy school now. But I have an entire dedicated video of baby Kristen in 2020 talking about how to study for anatomy. But I would say the most important thing is do not cram and do not try to memorize it without any context. Really try to understand what you're learning. Get a good atlas. I loved my Gilroy's Atlas of Anatomy, and I also had a coloring book from Amazon that kind of was a more like fun way to color. And also when you're in cadaver lab, take advantage of that time as study time rather than just like dissecting. Really like set aside some time to look at the muscles and nerves and really try to understand that bigger picture. What did you do in undergrad to prepare for physical therapy school? So a couple of different things. If your school has a ROTA, which is like the PT, pre-PT club, definitely join that, because they will give you a lot of useful tips regarding like application cycles and programs in your state, and kind of make sure you have all your ducks in a row. So definitely join your pre-PT club. Start shadowing as early as you can. Maybe even see if you can get a job at a local PT clinic as an aide, just to save up some money for grad school and also get some shadowing experience. That would be awesome. But really just try to do as good as you can in your classes to get into PT school, and you'll be great. What is your weekly work schedule? So every day is different, and it's also going to change next week when residency starts, but as of now, I work Monday and Wednesdays 7 to 3:30, Tuesdays 10:30 to 6:30, Tuesdays 10 to 6:30, Thursdays 10:30 to 7, and Fridays 8 to 4:30. But when I start my residency in 2 weeks from now, it's pretty much every day. I start at 7 a.m. except Mondays I start at 9:30. And some of those days are 12-hour days. Basically with my program, I'll still be treating for 40 hours. And then on top of that, there's additional hours of didactic coursework and then mentoring with my mentor. So it's gonna be some long busy days coming up here, but I am really excited. I think this is the last question I'm going to answer because this video is getting long, but that is just how long did all of your schooling take? So I graduated in May 2020 from the University of Georgia. That August I started at Mercer, and I graduated in May of 2021. 2023. So all in all, about 7 years. So it is a lot of schooling, and I feel like that's something some people don't realize, but all in all, 7 years. Okay, those are all the questions I'm going to be answering today. Thank you guys so much for watching this video and supporting me throughout my whole PT journey and this new chapter as a new grad and starting my residency program. I love you guys all so much, and I will talk to you guys in my next video. Bye!